Let's continue that discussion there on the first headline, the issue of cross-border travel, and that's certainly the case in the Western Cape and the Eastern Cape. As the country now is on level 4 of the lockdown, here on the AM report, we want to bring you the COVID-19 situation in each of the provinces, tracking what health departments are doing to flatten the curve. Now, the Western Cape, as we know, it surpassed Gauteng in the number of COVID-19 infections, with cases now sitting at well over 5,000, making the province the epicentre of the virus.
Yeah, that's right, certainly concerning. Now, Health Minister Dr. Zweli Mkhize has also raised concerns about that province, which shares more than half of the country's COVID-19 cases. Now, its governing party is calling for more relaxed regulation.
Yeah, let's get you the latest on that issue now. We're joined by the Health MEC of the province, Nomafrench Mbombo. MEC, thanks very much for your time on the AM report. I mean, the latest numbers that I can see here from Dr. Zweli Mkhize puts the number of infections in the Western Cape at 5,621, the number of deaths at 106. If you compare that to the other provinces, the Western Cape is well ahead of the other provinces in terms of infections. Are you with Alan Winde on the issue of the Western Cape reporting their numbers more accurately and the other provinces not doing so?
Good morning. Remember, that's not necessarily Alan Winde's statement. It's what the epidemiologists say, that per capita in terms of the testing, we are testing more. And also because we had a cluster outbreak where a large number of people got infected at the time, most of the essential service workers, at the time that we were even level 5. The supermarket clusters, the clusters within the old age homes, the clusters within the factories. So it resulted that we had to test more as we follow and trace the contact. And also, you need to understand that also the part of that, the numbers that we see is not necessarily the true reflection throughout, because we do have the backlog of the testing results across the country, meaning that if they would have completed the lab with the Western Cape results, and they haven't completed the other, because last time I checked, we had about 11,000 of the tests that we haven't received the results. And I'm aware Gauteng had almost 15,000. So if they would have completed Western Cape results, of course, so you'll have a new infection, because last time I checked, it says, I think, 400 and something, and then you see Gauteng 19. But that's not the point. The fact is, the epidemic in South Africa, the projections that were modeled that was done at the national level, they said that we'll have the highest numbers around August and September. The projections that were done by the epidemiologists for the Western Cape, it showed that we'll have those highest numbers around June. But now, the epidemic has come early for the Western Cape, but it doesn't mean that for the other province, it won't go up to that level. So right. We need to also to correct that. And then last, because I saw that you said epicentre, remember? Epicentre is the center where the outbreak started. It's the center point where the outbreak started. It's not about the place where there is a larger outbreak.
Right. So given the trajectory that the Western Cape is following MEC, there had been calls by several bodies, including the ANC in that province, amongst many other institutions, I guess, suggesting that perhaps an accurate response would be to try scale back to level 5 for the Western Cape. Do you think that type of intervention would work? I mean, what's your stance on that issue?
Remember, the clusters of the infections, it happened at level 5. These are the essential workers. People go to the shop, and then it has never been closed that people cannot go. There was never any limit, although the message has always been stay at home. Some of the factories, they open because they are the essential services. They bring essential services. The outbreaks in the prisons, in the police station clusters across the province, these are the essential workers. The outbreaks that also coming from the other essential service workers, for example, in the food industry, the agri-processing, these are essential services. So it's not like we only at level 4 that we have seen this. All of these originated from the essential service workers. Now the question is, will there be any difference, level 4, level 5? I won't know. Yeah. But what is crucial is about that we contain the virus and then we go to the hotspots. Hotspots is when now those infected, they go back into their own areas where they may end up infecting the rest. Because if, for example, in the metro, the factory or the supermarket is in the western sub-district, but we find that the people will be probably staying maybe in the southern or in the eastern, and then we follow the cases so that we could be able to test more in that area. Instead of going to a place where you do it everyone, and then you end up not yielding the positive cases. So that's what matters, to target the targeted testing, and also for the case finding. Go and find the case. If Nomafrench is positive, what are the links of the other people to Nomafrench? That's important.
Yeah, absolutely. MEC, you know, when we were tracking, pardon me, the story around the world, you know, a lot of news agencies gave us a sense of the kinds of conditions that hospitals were operating on. You know, we got a sense of Italy when it was at the worst part of the coronavirus, how hospitals were coping there, just how full they were, how patients were being treated. But we haven't really had that sense in our own country. Have you been able to visit hospitals? Have you been able to get a sense of what things are like at hospitals, especially where there are people in ICU?
Not necessarily going to the specifically to the clinical area, because you also have to be careful not to expose yourself, especially when we have to again engage with many people. Because if I go to the ICU where there's a protective clothing and all of those, it means then what are the chances that I'm still going to go outside, which is part of what the work that I do. But generally, you must understand that currently in South Africa, across not only the Western Cape, it's 10% of the people who get hospitalized, whether they go to the general wards or they go to the to the critical care or to the ICU. The majority of the people, 90%, they not necessarily get hospitalized, but they should be in isolation, or they go to what we call the field hospitals or the field hospital. A field hospital, it's where now you find that we use, like in the Western Cape, the city ICC, and also some of the warehouse where you can put up the beds and then you can have some oxygen. It's not necessarily that people need to have that highest interventions in terms of the medical intervention. Plus also people will need to go to a place when they've got a sore throat, but they don't need to be hospitalized, what we call triage and testing site, without necessarily going to the EC and to meet with the others, especially if you are symptomatic. So we already have those. Already in the Western Cape, there are about 18, but we are adding more. Same applies with the issue of for those already in the hospitals, at what extent that even when they need to be tested, that they could be tested, the results can come quickly so that the medical interventions can happen quickly. Talking about that, I get reminded that today is the International Nurses Day. One of the things that I've been trying to see to it is about, at least for the health workers, the test that is to be done for the health workers. We need to get those results earlier, sooner, so that to make them not only to be calm, but also for them to be able to continue with their work. We cannot have the backlog of the tests for everyone. For example, the mass screening and testing, but I don't say that the other people need to be delayed. But whilst the country is still looking at the capacity in regard to the availability of the testing kits, but the issue of the health workers need to be prioritized in terms of getting the results back. Same applies with those with a vulnerability related to the comorbidities, especially when they are already in the clinical area. Those need to be prioritized. Yes, in terms of the hospital beds, we have to divide them, as I indicated, that for the general beds, for the critical beds, for the ICU beds, so that you can see what kind of the resources you need. Because for the ICU, you need person trained to be able to work in the ICU. You need the resources like the ventilators, essential drugs that are used in that kind of a space.
All right, let's leave it there. Thanks very much for your time and your insights. Certainly appreciate it. That, of course, is the Western Cape Health MEC Nomafrench Mbombo.